I think that we can really work on the pipeline. So when I say the pipeline, I'm talking about kids starting from kindergarten and being exposed to not only to healthcare, but to what a rural life and rural healthcare can offer. Working on that pipeline, it's vital that we are collaborative, not only here at the Colorado Rural Health Center, but we need to work with our partners at the universities, at the training programs, to make sure that we are growing a provider base right from the beginning, right from when they start school, throughout high school, throughout their undergrad, and make sure we're not missing any areas. There are opportunities for students to work and do rotation, to train and do rotations in rural areas. Our residency programs, our PA and nurse practitioner programs do a great job at having their students do a rotation in rural, and we even have some rural training tracks, but it's not enough. There should be schools located in rural areas where their students live. I think some sort of payment reform is definitely a vital part of this. We need to incentivize our students to go into family practice, to make sure that when they finish their residency, that they have the opportunity to pay off their large student loan debt. I really see that a lot of residents or students going into residency see specialty care as that way to pay off their loan debt. Oftentimes, the salary and the wages in rural areas tends to be lower. And the folks that go there do it because that is truly what they want to do and that is their calling, but they usually get paid less. Another thing that I'd love to tell legislators is that the way our medical schools and our other health professional training programs need to change the way they recruit their students. The biggest part of recruiting students for a lot of, especially the medical schools, is based on their test scores. Recruiting students based on their background, their tendency to go to a rural area and to serve an underserved population should be a larger part of that recruitment. There are lots of positive things that I hear all the time, that I see all the time from rural practitioners. They are doing what they do because they have a real passion for it, and the folks that are staying and working in rural areas, they wouldn't want to be anywhere else.